Maternal health in our country is something that does not get as much importance as it deserves and demands, and is therefore a serious health issue that must be addressed. In this section of Health Talk today, we have with us Senior Gynaecologist Dr. Sonia Naik from Max Super Speciality Centre, Saket, to discuss some serious maternal health issues and postpartum care which is otherwise neglected. Welcome to Only My Health, Dr. Sonia Naik.
Thank you so much, Colleen, for having me here on this Health Talk.
So, Doctor, how crucial is maternal health and why is it that in our country it does not get the attention that it deserves?
Once the mother delivers, the entire focus shifts to the baby, which is the most awaited moment of the family. And over here, it's just not the family around, but it's the mother herself also. She stops taking care of herself as she was taking care of herself in the pregnancy. So the mother and the family both needs to be sensitized to the changes that happens in the mother, and therefore considering the mother's health and therefore indirectly the baby's health, this is of great importance that they should be sensitized together.
And what exactly is this postpartum stress that even many mothers are not aware of, and what causes this stress?
So postpartum stress is very common. Especially since we have these nuclear families these days, it's become very common. It happens almost in more than 90% of the mothers, it happens. More so in the working mothers, which I'll just tell you the reason why it happens so. But postpartum stress is generally you can make out, we call it as postpartum blues. And if it worsens, we call it as postpartum depression. So it's basically you can make out by this feel of the mother, look of the mother, that she's not interested in the surroundings, she's not interested in taking care of the baby, she's irritable, she cries for no reasons, she doesn't take adequate nutrition. So these are the kind of things that you can make out that the mother is stressed, and we call it as postpartum stress.
So how should the mothers cope with this postpartum stress?
So there are various factors. The most important one is the hormonal milieu. There's an entirely change in the hormonal milieu. She gets pregnant, there's a change in the environment in the hormones. She delivers, again a change in the environment. So she's been basically in 9 months, she's transferred herself from two times transferred from the hormonal milieu. So one is this. Then it's basically she's trying to be an ideal, a perfect mother. For instance, she's trying to breastfeed, but she's struggling with the breastfeeding for the first week. And she's now guilty that she's not being able to breastfeed. She's trying to be awake every time the baby gets up. So initial first 2 days she'll be probably able to do it, but then it takes a toll on her health and she's not able to do it. Again that guilt, oh, I'm not able to take care of my baby so well. I'm not being a proper mother. I'll not be able to be an ideal mother. So those sort of feelings they set in. Talk to them that see this is going to happen. You be prepared that you will have to stay with the baby and enjoy that phase. So even during pregnancy, we keep telling that enjoy the phase of pregnancy. Don't take it as a stress, don't take it as a disease. Just enjoy every phase of the pregnancy. There will be discomforts, but enjoy. Similarly, in the lactating phase, in the postpartum phase, just enjoy being with the baby, being with the family. You'll never have that time with the family ever again, as much time which you are spending now with the baby and with the family. These exclusive 6 months or 8 months or probably 3 months. This is the best time that you can have in your lifetime, spending with everybody around. So this makes them feel better.
So doctor, diet and nutrition plays a very important role during pregnancy. What role does it play during the lactation period? And what diet should the mothers follow?
So generally we have seen in the Indian families that either they'll feed them only with ghee, and which is very important, because ghee is required. Basically, they're taking care of the calories. So when a mother is breastfeeding, she spends 400 more calories than during her pregnancy. So now it is the time, like now you can say, okay, she requires one extra meal, which we never advise her during her pregnancy. We just advise her to take care of the quality of the food during pregnancy, but now the quantity also is important. The rest of the things, what they'll give her is just moong dal, khichdi and lauki, and nothing else. They'll not give her roti. They'll not give her any chole, rajma, other sabjis. These are not given to her. Ice cream they'll not give her. Curd, thanda hai. The uterus will not go inside properly. So what I generally tell everybody is like have a home cooked food. Don't buy food from outside. So if you're giving cooked food, cooked properly, in a nice way, not much of spices, not much of oil, it's absolutely fine with a mother. It's not that if you eat rajma and chole, the baby will become more gassy. It's not like that. The nutrition plays a very important role. Give her the normal food that everybody around is eating, but a home cooked food. She can eat dahi, she can eat ice cream, she can eat custard, she can eat all. Keep her happy. Talk to her. Talk to her about her needs, sensitize her to the different needs of the family now after the baby has come. So give her the same importance that she was getting earlier. So that makes a lot of change. So once we talk to her, once we give her the same importance, once we take care of the nutrition and we advise her that, see, earlier she was a working mother, now she's at home, but she's with the family, which she'll never get that. I think these all things, if we address it, she'll not have the postpartum stress. Even if she has it, it will not become into a postpartum depression. Some postpartum blues will be there because of the hormones.
And what should be the right source of protein or even carbohydrates for especially the vegetarian moms?
So the vegetarian moms can have dals, they can have sprouts, they can have soya, they can have besan. Besan is a very high protein. So they can have dal chilas, besan chilas, they can have tofu, they can have paneer, all the milk products. So in a lactating mother, okay, in the postpartum phase, it's just not the proteins. So we emphasize more on the proteins during pregnancy, but in the postpartum phase, we emphasize on a wholesome nutrition. Proteins is one part because it's taking care of the repair process going in the mother after the delivery. But calories again is important. So we have to take care of the carbohydrate intake also right now. We have to take care of the galactagogues. Galactagogues are substance, they are the food basically which increase lactation. So like we have dhania, jeera, ajwain, gur, sabudana. These are all things which increase lactation. Methi dana, they all increase lactation. So like if you see the galactagogues available in the market, the powders, they are actually made of all these things only. So these are therefore very important also in addition to the proteins and the carbohydrates that she requires.
How crucial is breastfeeding? What impact does it have on the mother's health as well as the baby's health?
So nowadays we emphasize that exclusive breastfeeding for 6 months. So when we say exclusive breastfeeding, means no water, no other liquids to be given, no other food, just the breast milk. So over here, breastfeeding to the mother, the advantages to the mother will be when she's exclusively breastfeeding, she is not ovulating. Okay, she's not ovulating means her estrogen production is less. So therefore, in the long term, her risk of breast cancer and also ovarian cancer becomes less. Just not only this, it's very important when she breastfeeds, her uterus involutes faster, comes back to its normal shape and size faster. Whenever she breastfeeds, her bonding with the baby increases. She gets more time with the baby. So the baby also gets that warmth, the cuddle when the mother is breastfeeding. And as regards the baby, the breast milk is, nature has designed it very well. So in the initial first few days, it's called as colostrum for the first 2-3 days, wherein the fat content is high. And then gradually the protein content increases gradually. And it also contains substances which increases the immunity of the baby. So therefore the long-term immunity, baby doesn't get allergies. So these are very important things.
So most mothers these days are working till the very last few weeks of their pregnancy to save up on their maternity leave after birth. Is this a healthy thing to do?
If there are no medical disorders which says that she should take leave and she should take rest, she can definitely work till the end. But over here, she has to reduce the number of working hours. She has to take care of herself. So sometimes they get so busy that around 32-34 weeks onwards, we tell them to monitor the fetal movements. They're so busy with their work, they just don't care about the number of movements. They forget about, obviously, so they're so busy with the work. So the work has to be that kind that they are careful about the baby movements. They're careful about themselves, their nutrition, that they're taking adequate food, quantity and quality of the food at adequate times. And it's very important they're doing the prenatal exercises also as have been told to them. And rather some of these exercises we tell them they can even do it while sitting at the office desk. They can just move around, they can take the steps, they can sometimes squat, they can do the upper body exercises in the office itself. They can do deep breathing exercises, sometimes meditate. So they can work, but with caution about all these things.
These days, a lot of women are planning their pregnancy in their mid-30s. So what contraception advice would you give to them? And, how should they be spacing their pregnancies?
So earlier we used to tell them that at least give a 3 years gap, because most of the women used to get pregnant in their 20s. But nowadays we see that most of them are actually getting pregnant, or while after delivering they are nearly in their mid-30s, as you said. So over here, if I tell them she's delivered at 33 or 35, if I tell her, now give a gap of 3 years, she'll be around 37, 38 years, which is too late for planning a second child. One, because of the low ovarian reserve. Our ovarian reserve falls lower and lower as we get older. And second, obviously, your strength, your stamina reduces. You can get more medical illnesses as you grow older. So it's always better to plan pregnancies earlier. So therefore, when we discuss about contraception, it's important that we see their age, we see their if they have any medical illnesses, and we see their BMI. And accordingly, when it should be best for her to plan the next pregnancy. Suppose she's had a normal delivery or even a cesarean and she's already 37. We can't tell her to wait for another 2-3 years. So she has to plan earlier. So therefore, depending on the age, her if she has any medical illness, and her BMI. So depending on all these factors, we advise her what is the best method of contraception. It could be just breastfeeding itself, and then she can plan a pregnancy. It could be some contraceptive pills, progesterone only pills, or the contraceptive pills once if she's stopped breastfeeding. It could be implants, subcutaneous implants. It could be intrauterine devices. So any of these methods, depending on all these factors that I've cited earlier, we can then give her the contraceptive choice, and then she can choose amongst them.
Cervical cancer is still the second most common cancer in India. So what advice would you give regarding its prevention and screening?
So this is one of the great opportunities that we have to discuss with the mother regarding cervical cancer prevention and screening. Sadly, in our country, we haven't advertised so much about cervical cancer prevention and screening, whereas there are some countries like Australia and some Scandinavian countries, they are on the verge of eradicating the cervical cancer through prevention and screening. So over here, we have to tell them that cervical cancer is caused by a virus which is sexually transmitted by the HPV virus. And if we give her this vaccine, if she's missed upon this vaccine, so we call it as a catch-up vaccination. If she's missed up with this vaccine in the adult age or the adolescent or before she got sexually active or earlier, so we can give her this vaccine now. There are 3 doses of the vaccine, 0, 1 or 6, 0, 2 or 6. So we give her 3 doses of the vaccine. That's for lifetime. She doesn't have to repeat. There's no booster dose. This is the prevention part. Now the screening part is very important. This cancer doesn't develop within a month or 2 months or so. So it's a very slow growing cancer, cervical cancer. It takes 10-15 years to form. So if we're doing a pap smear every 3 years, we come to know of changes much earlier. And it's not a painful test. It's a very nice, tender, small brush. We just take the discharge with that brush into the vagina. We just take the discharge over the cervix. So in that we have the cervical cells, and we make a slide and just see it. So it's not at all painful. So half the people will not come thinking that it's a painful test. So the women should be aware that pap smear is not painful. It just takes 10 seconds to do this test. It doesn't require a long procedure. It's an OPD procedure, not at all painful. So therefore, this is very important that the women do these pap smears every 3 years. They start 3 years from being sexually active till the age of 65. They do it every 3 years. And this is the best time, the opportunity that we get to discuss with the women. So it's very important that we discuss about this fact also.
Thank you very much, Dr. Sonia, for coming on board and talking to us about these very serious maternal health issues and also informing the new mothers and the expecting mothers about some things that they definitely must keep in mind.